I'm Dr. Sechrist, and if you're watching this video, that probably means that you either have hip or knee pain or have been told that you have hip or knee arthritis, and you're trying to figure out what to do from here. I want to help you navigate that process, and I also want to set expectations about how we can make this decision. A lot of us are used to being told we have some diagnosis by a doctor and then having the doctor tell us exactly what we should do about it. But that's not how we approach this problem. It really depends entirely on how it's affecting your life and what you stand to regain from a potential hip or knee replacement. And that's what I want to go through with you in this video. I want to explain what we can expect from a hip or knee replacement long term, what the annoyances you might have with it would be, and then what the reason to proceed with the surgery would be. I'll also go through some of the alternative treatments and hopefully help you navigate this process so that we can get you doing the things that matter most to you despite your hip or knee arthritis. In many cases, just knowing what arthritis is and how you can avoid provoking the symptoms is enough to empower patients to control their hip or knee pain to a degree that they can live their life and not be bothered by it. This can start with some really simple things. Losing weight can decrease the amount of stress that goes across the joint. Increasing your strength and balance in the muscles surrounding the joint, again, offloads that joint and decreases the amount of stress that's going through it. And then we can get into exercises. Those obviously help with strengthening, but we need to do ones that avoid provoking your pain. And I'm going to go through in a second how we can think about which exercises are going to be least likely to provoke an exacerbation of your hip or knee pain. Exercising with hip or knee arthritis requires striking a really delicate balance between doing the most exercise you can in order to keep the joint healthy and also avoiding provoking your pain. We know that the best thing for the health of your remaining cartilage is exercise. However, we also know that if you move that joint, that's what can cause it to hurt. So this requires a little bit of experimentation. What is the most that you can do in order to keep that joint healthy without sending yourself into an episode of pain because of your arthritis? And this can be thought of like a ladder. The higher you get on this ladder, the more strenuous the exercise is. And that means it'll be more beneficial, but also more likely to provoke your pain. And you're going to have to find where you fall on this ladder of what you're able to do with your hip or knee arthritis, and also determine whether or not that's an acceptable level of activity for you. One thing that's helpful to know is that the less we can have your foot impacting the ground, the less likely it will be to provoke your pain. So one thing that may be a little bit surprising is that riding a bike, which seems like more strenuous exercise than walking, is actually easier on your hip or knee because when you walk, your foot is impacting the ground and it's driving that force through your arthritic hip or knee. So we can do some things to augment your ability to climb this ladder and be higher on this. But again, this is a little bit of an experimentation process to find out where you fall here, given how severe your arthritis is and how severe the symptoms that it causes are. Now, I know of a few areas in our community locally where you can find places that will accommodate your decreased mobility as you're working to do some form of exercise. I've listed them over here on the right, along with some phone numbers. If there are additional ones that you know of that you would like to see added to this list, please let me know so that I can let my other patients know where they can go to find some form of exercise. With just that information and advice, many people will be able to have the tools in their arsenal that they need to manage their own arthritis. As we move up from there, we get into over-the-counter medications that you can use to help control your symptoms. This includes topical medications which contain anti-inflammatories in the lotion, such as Voltaren, or over-the-counter medications such as Tylenol or ibuprofen. These can be used as needed and may help to control your symptoms, particularly on days when you're going to be especially active. If over-the-counter medications are failing to control your hip or knee pain, we can accelerate from there to prescription medications. And by this, I mean anti-inflammatories. I really strongly recommend against ever using opioid medications for chronic hip or knee pain. But if you have good kidney and stomach function, you can use a course of prescription strength anti-inflammatories to control your pain. Additionally, some patients like to try bracing or use a cane in order to control their pain. This can help to offload your joint and may be enough to alleviate your symptoms and allow you to continue doing what matters to you. If all of those things are failing to control your symptoms, then we can try injections. I'm much more aggressive about recommending injections into the knee than I am into the hip for reasons that I'll cover later. Generally speaking, I prefer to use viscosupplementation over corticosteroids, although I do use both. And the reason is that the risks associated with viscosupplementation, which is just synthetic joint fluid, are lower than the risks associated with corticosteroids. The reason for this is that corticosteroids have a massive effect on many different genes in your DNA. And we don't know what all this does. However, viscosupplementation is very simple. It's just the joint fluid that's created by the cartilage cells in your own natural joint. And we're essentially topping it off like you would top off the oil in a car. So I do a lot of that. And if we can keep your symptoms at bay with periodic injections into the knee, then that's a much lower risk option than talking about surgery. And then we get to the top of the pyramid, and that's a joint replacement. I only want to have a conversation with you about a joint replacement if you've attempted these other treatments and been unable to continue doing the things that matter to you. If you're still having pain, then that's the point at which we can have a serious discussion about these surgeries. Now, I want you to remember that the reason to do a hip or knee replacement is not because you have pain. You'll still have mild aches and pains in your hip or knee afterwards. The reason to consider it is if that pain has taken away some valuable activity from you that you're willing to go through some effort to get back. This is an incredibly personal and lifestyle-based discussion that hinges on what matters to you, what you've tried to control your arthritis, and whether or not you've been successful in continuing to do those important activities with non-operative treatments. If you are in a place where your hip or knee pain has robbed you of something valuable to you, then that's when I think we have the discussion about whether or not the hard work involved in a surgery recovery will be worth it in the long run for you to get those things back. The most important question is, after you've made that full recovery, will it be worth it? And if we look at studies of patients who've had a hip replacement, about 95% of them report being satisfied or at least neutral with the results of their surgery. Put another way, only 5% of patients who've made a recovery from a hip replacement regret having gone through it in the first place. And here's what a total hip looks like. As you can see, we have a stem that goes down the femur and then an acetabular component that goes into the acetabulum. And a ceramic ball on the end of the femoral stem rubs inside a plastic liner in the acetabular component, which forms your new hip joint. Satisfaction rates following a knee replacement are a little bit lower. You can see here that the proportion of patients who report being very satisfied is lower following a knee replacement than following a hip replacement. This is part of the reason why I'm more aggressive about recommending ongoing injections for knee arthritis than hip arthritis. We have to be aware that for a knee replacement, the likelihood that you're going to be thrilled with the result of your surgery is lower than a hip replacement. So this means that I will prolong non-operative treatment longer for knee arthritis than I will for hip arthritis. Here's what a total knee looks like. You can see that we've cut off the ends of the cartilage, which were worn out, and replaced them with metal and plastic. But we leave in place the ligaments, tendons, and other soft tissues around the knee, which were functioning that way beforehand. And this is why you can still have aches and pains in this knee. It's largely the same knee that you were born with. We've just replaced the worn out portions. Interestingly, if you are a candidate for a partial knee replacement, the satisfaction rates are actually closer to a hip replacement than they are to a total knee replacement. And if you're in this situation, it's something that we can discuss. Now, this requires a close analysis of where your pain is occurring at, as well as your x-rays to see where your degeneration is occurring. In some cases, we even need to get an MRI to evaluate further what the other portions of your knee look like. This requires a detailed conversation, but does provide the potential for a little bit better recovery than what you would have following a total knee. And this is what a partial knee looks like. As you can see here, we've preserved more of the native structures of the knee. This is part of the reason why the recovery is faster and patients are able to do more. We've preserved those normal structures in a larger portion of the knee. This is also why it's so important to investigate it really carefully before we commit to doing that surgery, to ensure that those portions of the knee that we're going to leave alone are in good shape and we're not burying our heads in the sand and dooming you to another surgery because we're ignoring degeneration in parts of the knee that we're going to leave alone. Because I think the most important thing you can do psychologically to prepare for surgery is to have a goal. We are not going to put back in what was in your hip or knee when you were 20. We're going to put back in metal and plastic that will function very similar, but it's not the same thing that you were born with. You still will have mild irritations related to your artificial joint. And if you are basing this entirely on whether or not you notice it throughout the day, you may find that long term you can still tell that you had an artificial joint. However, if there's something that you can't do right now because of your pain, and you regain the ability to do that after working with exercises following the surgery, then I think that's what equips people to say, yeah, this was worth it. I couldn't garden. I couldn't get on my boat. I couldn't go for a hike. I couldn't ride a bike, whatever it is for you personally. And afterwards, when you regain that ability, that's what allows you to say, oh, absolutely, this was worth it. I got something back that matters to me, and now I'm in a better place than I was before. So that's why it's so important to me that we have goals that are realistic and that we're working towards together as we work through this recovery. One of my favorite things about practicing out here in Skagit County is that people generally move here because they enjoy being outside. And these types of outdoor activities are a perfect example of what we can restore if you've lost your ability to do them because of your hip or knee arthritis, despite using some of these non-operative interventions. So I think a fun exercise to conceptualize what we can expect to restore following a hip or knee replacement with these types of outdoor activities is the ski to sea race, because nothing typifies how amazing it is to live out here better than the ski to sea race, where you go all the way from Mount Baker to the ocean in this big relay. And so if you were to try to do this with a hip or knee replacement, I want to go through each of these things and talk about what a realistic expectation would be following surgery. We can start with skiing, and this is both downhill and cross-country skiing. And this has been studied by the University of Utah. What they found was that it takes patients a while to get back to skiing, roughly a year. However, after that recovery, patients are able to ski with just as much skill as they were able to before their surgery. The next leg on the ski to sea relay, if you were to conceptually do this by yourself following a hip or knee replacement, is running. And this is a really interesting one. Running was traditionally not recommended for patients who had undergone a joint replacement. And the reason was our traditional plastics, which were implanted before about 2005, used to have a shelf life on them, and eventually they would wear out. The newer plastics are not showing this type of wear. And the reason is they changed the manufacturing process around 2005, and we don't see this issue anymore. So some patients have run marathons on a hip or knee replacement. Now, if this is the reason why you're doing it, I think it's important for us to have a really nuanced conversation about what we can expect in terms of running function. However, I won't tell you that you can't run on a hip or knee replacement. The next leg is biking, and this is a phenomenal activity to do either before or after a hip or knee replacement. If you're able to bike, it's a great way to keep your strength up beforehand, and it's one of my favorite activities for my patients to engage in afterwards because, again, there's no impact on the ground when you're pedaling your bike. And then finally, we get into canoeing and kayaking. And I think this demonstrates a really important thing to be aware of with knee replacements. If you are canoeing or kayaking and you're able to sit, obviously that's largely an upper extremity driven exercise. However, if you kneel, you may feel very uncomfortable. Generally speaking, patients don't like kneeling after either a total or a partial knee replacement. This is because the scar goes right across the front of the knee and you're left with a small numb spot on the outside of your knee. It can feel uncomfortable to kneel because of this, and most patients choose to avoid activities that involve kneeling. Overall, what I hope this demonstrates to you is that if you've been robbed of getting outside and enjoying being in the best place on earth because of your hip or knee arthritis, that's something that we can get back to you. It will take work, but we can get you back there. Here you can see the recovery curve following a total hip replacement. There are a few important takeaways here. The first is that patients are very rapidly doing better with regards to the function of their hip than they were before surgery. But the other is that it can take a long time to reach 100% of the recovery. And this is largely because as you have hip arthritis and are using that hip less and less because it hurts more and more, you lose strength around the hip, and it takes a long time to regain this. So as we're getting out into the 3 to 6 to 12 month time period, you're still making gains in the function of that hip and still seeing improvement over time. It can be challenging to be patient once you hit that point and want to be doing more and more and more. However, it's largely dependent on your recovery of your strength, and that just takes time. We can then compare that to the recovery curve from a total knee. And what you'll see is that similarly, patients are very quickly doing better than they were before surgery. However, the recovery is slower. And this means that it can be more frustrating to make the recovery from a total knee, and it takes more work. This is part of the reason why more patients choose to put off a total knee than a total hip. However, you can see that similar to a total hip, long-term patients make that 100% of their recovery by a year out from surgery and are long-term much better off than they started. What I hope you take away from this is that if you have hip or knee arthritis, there are a lot of treatment options we have to control your symptoms and allow you to continue doing the things that matter to you. However, if your symptoms are so severe, even with those interventions, that you can't do something important to you, that's when a hip joint replacement becomes an option. And the joint replacement is an option not so that we can eliminate all the pain you're ever going to have in your hip or knee. It's an option so that we can get you back those activities. I'll have to do a lot of hard work during your surgery, and you'll have to do a lot of hard work during your recovery. But if we put in that effort together, we can get you to a better place. And that's what I really enjoy with my patients, is when you get back to doing something that you couldn't do beforehand that motivated you to have that surgery, to the point that I'll even ask for pictures of it. And I keep a slideshow running on my wall in my office at all times of the goals and milestones that my patients have hit. And that's the reason why I do what I do. So if you're in a place where you have something that you want to get back and you're willing to go through some hard work to get that thing back, that's where we can have a conversation about the role of a hip or knee replacement for you.